questionnaires are not, 100% definite, but it's definitely a good way to kind of gauge what your patient is going through and kind of go from there. Welcome back to my channel. If you haven't seen any of my videos before, my name is Natalie. I am a family nurse practitioner, and basically the goal of my channel is to help pre-nursing, nursing, as well as FNP students get through school as easily as possible. I also take a look at personal statements and resumes, so if that's something that you need done, please take a look at the description box down below, and it tells you about the whole process of how that can be done. So for this video, I wanted to talk about common healthcare questionnaires that you would be using in a primary care setting at your clinical. Basically, all the ones that I'm going to talk about today, I used almost daily, if not definitely weekly, when I was at my primary care clinical, and I think they're important to know because you're probably going to see patients like this almost all of the time. And if you are able to use your own computer with the EMR on there, I like to have like little tabs of bookmarks of all of these different healthcare questionnaires because you use them so frequently, just so that it's in a quicker process and just so you get a gist of kind of what they're for and what types of questions they ask, and we'll go from there. So the first one that I'm going to talk about is PHQ-9. So that basically wants to see the severity of the depression that your patient has. So basically, I will put a link of all of the different healthcare questionnaires that I personally used that were very, very helpful. It was on MD Calc. So it was definitely very helpful to have these handy to be able to see how depressed are your patients, and if they're on many medications, see if they are helping or if they're getting worse or they're kind of the same, that sort of thing. So PHQ-9 is the first one to see the severity of your patient having depression. So basically the answer choices are not at all, several days, more than half the days, and nearly every day. So certain questions are things like, do you have any little interest or pleasure in doing things? Are you feeling down, depressed, or hopeless? Trouble falling asleep or staying asleep? That type of thing. So basically you're gonna go and you'll see all the questions, and then they have the answer choices and you answer what your patient says. So basically, at the end, they're going to have a total points to see if your patient is mildly depressed, moderately depressed, or severely depressed. And basically, based off that, you can see what medications would be good, see if there is a, medication and maybe a therapist that can go along with it to see if that can help, a dual combination, or you want to see maybe the doses that you're going to use for the particular patient. So that would be the first thing that I would have on your bookmark. A lot of patients are depressed, especially after all these times. I mean, it's completely understandable, and especially for the older population too, it's definitely good to ask. If you have patients that come and they say that they're very fatigued, but there's really no changes in their work life or in their eating or in their habit and their exercise habits, it could be depression. So that's something that you want to keep in mind. So the second thing I want to talk about is what is called Gad 7, and basically that is testing to see if your patient has anxiety, and if so, what level of anxiety. So it's the same type of thing where they have a bunch of answer choices and they have a bunch of questions, and you kind of click through what the patient is saying. So for this one, the answer choices are kind of the same, like the depression, the PHQ-9, so it's the answer choices are not at all, several days, more than half days, nearly every day. And some of the questions are, do you feel nervous, anxious, or on edge? Are you not able to stop or control worrying? Do you have trouble relaxing? Is it hard to sit still? Are you very restless? Stuff like that. And again, based off whatever the patient says, it'll tally up the points for you to see if your patient is, mildly anxious, moderately anxious, and severely anxious. And again, that helps to determine if they need to be on medication or not, what dosage. Do you think that they should be combined with some sort of therapist or psychologist to help with their anxiety, maybe help them with coping skills or how to deal with anxiety, if it's social anxiety versus not, that type of thing. These questionnaires are not, 100% definite, but it's definitely a good way to kind of gauge what your patient is going through and kind of go from there. So that's another thing that I probably used daily, if not every other day. It's definitely very important to have. And again, a lot of people are going to be anxious, especially during these times. So it's very important to ask if they've had any level of anxiousness. So that's something that I would definitely have in your toolbox when you are seeing your patients. The next little questionnaire that I want to talk about is the Ascbd risk score. This definitely I probably used every single day. This is basically to see if you're a patient that has high cholesterol needs to be on some sort of medication like a statin. So they ask different questions on here, and this is the American College of Cardiology website. This is not the MedCalc, but I'll link it for you down below. So the questions that they ask are current age, if they're male or female, what their race is, systolic blood pressure, diastolic blood pressure, their total cholesterol, HDL cholesterol, LDL cholesterol, have they had a history of diabetes, are they a smoker, former, current, on any hypertension medications, are they currently on a statin or aspirin therapy. So basically you'll go through all of those questions, and when you are asking these questions, what I did was, like, it asked for the systolic blood pressure, diastolic blood pressure. I did those blood pressure readings on the day of their visit, comparing them to the most recent labs that they've had. And most of the time when people are doing labs and they're checking for cholesterol, they'll come back, and if they have super high cholesterol, they'll do this Ascbd risk score to see if they need to be on a statin. So do the most recent labs with the most recent blood pressure for that, and then pretty much everything else is going to be the same, whether it was, you know, a long time ago or now. So that's something that I probably used all the time. It's a very, very handy tool. If your patient has a Ascbd risk score of a 7.5% or more, they need to be on a statin, period. There is no question about it. If your patient is 20%, the Ascbd level is 20% or higher, they must be on a high intensity statin. You will learn all of that, but that's just something to keep in mind, because we want to help these patients reduce their cholesterol so that they have reduced risk of any heart attack or stroke. And you can relay the importance of that. And again, it's a simple test, but it's very helpful to ask these questions to gather this information so that you can help prevent any further complications to your patients. And this is something good too, because let's say you know that your patient is coming back for lab results and you see that their cholesterol is astronomically high, you can already start inputting this information based off their chart, and then all you would need to wait for is their blood pressure for the day, and you can calculate it and already put it in the chart before you even see the patient. So that's another thing to have to kind of prepare for your visit, and this is something you're probably going to be using every day, if not definitely weekly. So the next one that I wanted to talk about was the Ottawa ankle rule. I did not use this very, very often, but definitely it came up every once in a while. And basically it's going to help see how significant a foot or ankle fracture is to be able to reduce the use of x-ray imaging. So there's only a couple of questions that it asks. So basically it asks the location of the pain. Is it malleolar? Is it midfoot? And is there any inability to bear weight both immediately and after injury and in the ED? So you ask those questions, you get the answer, and basically it says whether or not the patient needs to go for x-ray. And it kind of just helps to determine if it's really a significant need for an x-ray imaging or if it's something that probably would heal on its own. Again, it's not a perfect test, but it definitely helps to see whether or not you're putting your patient at increased exposure going to get an x-ray if it's not 100% necessary. So again, did not use this super frequently, but I would definitely keep it in your toolbox, as someone is bound to come in with it at some time, definitely in primary care. So the next one I want to talk about is center criteria, and basically that helps to see if your patient has strep pharyngitis. So we want to see basically if it's bacterial versus viral. There's different questions that you can ask, there's different exams that you can do. This one is on MD Calc also, so you can see whether or not your patient needs to be on antibiotic or not, and we'll go through some of those questions. So basically they have, what is the age group of the patient? Is it 3 to 14 years, 15 to 44 years, or greater than 45 years? And you get a point based on whatever age group that patient is on. So you want to see if they have exudate or swelling on the tonsils, if they're tender, swollen anterior cervical lymph nodes, do they have a temperature greater than 100.4 degrees Fahrenheit or greater than 38 degrees Celsius, and if there is a cough present or not. And then of course now with COVID, is it a COVID-19 patient, yes or no? So let's just do a quick one real quick. I'm just gonna do it really quick, just answering random questions. So for example, I got a 3 on this, Mato patient that I just answered some questions. So for this one, a 3 would be consider rapid strep testing and or culture. So based on the points you get, you're going to say, nope, they're fine, don't worry about it. Or if you get higher points, that you're going to have to do some sort of strep throat test, or if not, you have to give them medication. So basically you go through that, and again, it's to see whether or not that you're exposing your patient to unneeded antibiotics, because you do not want your patient to have antibiotic resistance, especially for a time that they're actually going to really need it. So again, it's just kind of seeing any type of way you can prevent unintended exposure for your patient. So that's another thing that I used frequently, but definitely not daily. So the last one that I wanted to talk about was Epworth Sleepiness Scale, or Epworth Questionnaire. And basically that's to help see if your particular patient may have obstructive sleep apnea. So you ask certain questions and they give you a score basically to see if it's a possibility. A lot of times people might come in, they say, I am so fatigued, I am just so tired in the morning, I don't understand, like I slept, but I'm just so fatigued. And sometimes some people have sleep apnea and they don't know it, and because sometimes they, stop breathing at night for a couple seconds, or they like gasp in the middle of the night, or they're just snoring so heavily that they're not getting proper sleep, and that's why they might be fatigued. So that's something to do, because if they have a certain score on this Epworth questionnaire, then you might want to do a sleep study to see if they actually have obstructive sleep apnea. So that's something, again, I did not use this super often, but definitely I would put it on your toolbox. And if anyone is coming in, especially for fatigue, I would definitely do depression. I would do this Epworth questionnaire to see if they have any sleep apnea. So those are all of them. Let me see, there's 1, 2, 3, 4, 5, 6 of them that I used pretty frequently. Of course, this is not exhaustive of all the different types of questionnaires that you can be doing, but as far as the most common ones, I would definitely keep those in your toolbox. You'll probably be using them at least once in your clinical rotation, especially primary care or family care. So that's something that I hope was helpful. I will link all of them down below so that you can have them with you, so you can ask your patients all these questions and get them the best care that they can have. Thank you guys so much for watching. I hope it was helpful. I hope you guys have a wonderful morning, afternoon, night, whatever time it may be. And remember to always believe in yourself. All right, you guys have a great one. Bye.